Alrighty, everybody. Thank you so much for coming today. We're going to go ahead and get started for sake of respecting everyone's time. My name is Courtney Hasha. I am the training manager for the Wyoming Primary Care Association. And today is part one of our three-part veteran care series. Today, as you can see on your screen, hopefully everyone can see it. Please chat or let us know if you cannot. The title for today is Help Them Not Have to Ask, Meeting the Needs of Your Veteran Patients. And we've got a couple of really exciting guest speakers, as you can see sitting with me here today. We will be kicking off with part one today. You will also have received information regarding parts 2 and 3 in the invitation and our flyers. Respectively, those are veteran care, pushing through the paper of the Mission Act, and military culture, enhancing clinical competence. Those are the next two series, respectively on the 23rd and the 28th. We'll keep sending those reminders out though. And I want to go ahead and kick us off here with our wonderful speakers. I'm going to introduce first Sabrina. Today's first speaker is Sabrina Lane from Wyoming 211 Incorporated, where she found her passion after completing school, earning degrees, and starting her nonprofit career. She initially served as board of the directors for 211, and from there she was named executive director. She loves to support local community organizations, spend lots of time with her kids, and time outdoors. So we are so lucky to be working with Sabrina as a new partner in our community for the WYPCA, and we're really excited to work with her in the future. And bear with me while I figure out why we are not advancing slides here. So there's a cute picture of Sabrina. That's what I was just talking about. Isn't that adorable? Our other speaker today, our second speaker, is going to be Samuel E. House. He has been a public affairs officer at the Cheyenne VA since 2014. Sam is a veteran of Operation Enduring Freedom, enlisting in the Nebraska National Guard in 1988. He has served in various roles of increasing complexity and locations in the military, including Panama, Germany, Afghanistan, and the detention facility in Guantanamo Bay, Cuba. So we may have more questions. Prior to accepting his current position, Sam worked as the Deputy Director of Public Affairs for NORAD and the U.S. Northern Command in Colorado Springs. So we've got two wonderful experts with us here today. All right, and these are, of course, our learning objectives that we have mentioned in our training flyers as well, but today we'll be working to distinguish the role that 211 plays in connecting veterans to services for self-reported needs. Our second learning objective is to advance their knowledge of the process and offerings within the VA as they relate to meeting the needs of Wyoming veterans. And our last is evaluating the options available for all vets, whether or not they've been properly enrolled or not. It's a big part. And I'll hand it over to Sabrina.
Great, thanks Courtney. Hi everybody, I'm Sabrina Lane. I'm the Executive Director for Wyoming 211, and I'm really thrilled to be here with you today to talk to you about Wyoming 211. We're going to go over a few things. We're going to talk about who we are, how we got started, how our process works, and some of the services that we provide. So we'll go ahead and we'll jump right on in. So the World Health Organization has defined health as the state of complete physical, mental, and social well-being, and not merely the absence of disease of infirmity. Today, many health experts are promoting the importance of identifying and linking patients to social determinants of health to improve health outcomes. So as you know, social determinants of health are conditions that in the places where people live, work, learn, and play that affect a wide range of health, functioning, and quality of life outcomes and risks. This suggests that when upstream triggers such as work, water, air, food, and transportation go unmet, our health downstream is affected. So when patients are in crisis, they often put their health on the back burner. Leading studies suggest that social and environmental factors account for nearly 70% of all health outcomes. So while healthcare providers know that addressing these social determinants of health improves health outcomes in a significant way, You can't possibly be expected to know every health and human service available or those programs that exist, and nor do you have time to research or have your staffs do that research to investigate what is out there. And more often than not, it's difficult to ask people about their situation at home when you don't have something to offer them. So you can see here by this scrambled mess of resources, if you will, when the veterans come back to their hometown, they don't know what to do or where to go. And often the challenges that veterans face are too big and complex for any single healthcare professional or organization to solve alone. Veterans often they don't know where to start. First of all, they may be unaware of the services, whether it's a community service or a service provided by the VA. Access to these community services is not as simple as searching on Google, and I'll talk about that in just a moment. And navigating the complex VA system, the benefit requirements or other services is often overwhelming. So, and lastly, they may just be too proud to ask, and we've had several of those conversations as well. So this is where 211 comes in. Healthcare providers who are working to improve the health of patients struggling with life's basic needs can add 211 to your healthcare team. Wyoming 211 can help your veteran patients find programs and services to meet life's challenges and improve health outcomes. Fortunately for all of us, there are many services available around the state to assist veterans with unmet basic needs. So when a veteran dials 211, our trained specialists can help them navigate the complicated health and human service system and the complex VA system to provide them with vital information on available services to meet their needs. In addition, by applying what we know about social determinants of health, we can provide awareness of programs and services which help improve one's health, with tools to help move them out of poverty and onto self-sufficiency, and ultimately help improve the overall population health. So who is Wyoming 211? Well, we basically are a one-stop source of information. Wyoming 211 is a comprehensive statewide provider of information and referral. We are a centralized access point for community information, and we really cater to those health and human services for individuals who are looking for those essential needs such as food, shelter, counseling, health insurance, employment assistance, and more. So as you can see, 211 is an easy to remember number. It's a free helpline for those individuals who are looking for community services. And we also provide a couple of other services where we can work with communities to help them assess needs and gaps in services. And we also work in the disaster recovery realm where we provide information dissemination. This is our staff. We are a very small staff. There is myself as the director. We have Miss Lisa over here. She is our community resource specialist in the left-hand corner. And Jane is our database curator. She's been with our organization since 2012. And she is our go-to and works with all of our social services and governmental agencies to get their services into our database accurately and efficiently. We are located in Cheyenne. While we are a statewide agency, this is where our office is located. We are housed inside the United Way office in Cheyenne. Our office hours are Monday through Friday, 8 a.m. to 6 p.m. So for those of you who do not know, 211 actually is a nationwide network of call centers. In July 2000, the Federal Communications Commission set aside the 211 number for the public to more easily access community information. So we are very proud to be a part of that, that network. And as you can see, 211 is available in all 52 states across the country, as well as Canada and Puerto Rico. With all of those call centers combined, we're able to reach about 94.2% of all of the states and citizens across the country. And fortunately for us, Wyoming 211 is able to access 100% of the residents in the state, assuming they have either a landline or have cell tower connectivity. So in 2018, 211s across the country helped answer over 12.8 million connections to help, and most of those were related to housing, utility assistance, physical or mental health services, assistance in finding employment, and services to address and preventing homelessness. So how do we work? I was sitting with a funder one day, and I love to share this story because it really gives a great depiction of how 211 works. So as I mentioned earlier, we are a one-stop source of information. So I'll give you a scenario. When I was visiting with this funder, she asked me, she said, so what makes 211 relevant in the day of Google? And I said, that is a fantastic question. And I think the number one answer to that is the fact that we have the human connection. So an individual can call 211 and they can get a multitude of resources in one phone call. Whereas if you were to reach out to Google and do a Google search, you will go and you will look for a particular resource and you will come up with a couple of agencies that provide that particular resource. So let me give you a scenario as to what I'm talking about. A woman calls and she is in crisis mode, and she received a disconnect notice for her utility bill, and she doesn't have the money to pay for it, and she doesn't know what to do. She goes on to tell Lisa that her husband just left her. She's never worked a day in her life. She has 2 kiddos. Her son is lashing out because dad left and nobody knows where he's at. Mom doesn't have any money. She's never worked. She doesn't know what she's going to do about food, and she's just scared about what's next. So Lisa has listened to this woman's story, and she assures her that we can provide her with some resources that could possibly help her out. So first of all, she addresses the number one issue why she called, which was to get assistance with utility services. So she refers her to Salvation Army here in Laramie County, who could potentially assist her with helping her out with that bill. Then she goes on to say, you mentioned something about worrying about food, so I'm going to refer you to Needs, and that's a food pantry here in Cheyenne, and they can help you out with food, clothing, and other services that you might need as well. And let me give you another service. Climb Wyoming. When you get through this hump, why don't you reach out to Climb, and they can possibly get you on board for employment training, can work on building a resume with you, and get you back in, or get you into the workforce so that you have sustainable income to take care of your family. And we can go on and on with some of the other situations that she posed in that particular scenario, but you get the idea. So with Google, you get one resource, you get utility service assistance because that's what you were looking for. But with us, you get utility service assistance, you get food assistance, you get housing, shelter, counseling, and so on. So we can provide multiple services in one call, and we can do that through our human touch. So in my opinion, we're far superior than Google. So how do we provide those referrals? Wyoming 211 maintains a comprehensive database. And this database recently went over to a new platform, and we went live with that platform in October of 2018. And this new platform provides us with a new website, a new database feature and capacity. And our website provides us with a new, fresher look. It's much more user-friendly than it used to be. We have unlimited space for agencies and services, client records, public access. We also have API capabilities where we could potentially share our resource database with a hospital, for example, for their case workers to have those resources at their tips when they are discharging clients or patients. Our database also has functionality where we can send out annual reminders to our agencies to update their information. And we also have an electronic form for agencies to update their organization, or when we don't have an agency, they can automatically update that through our website as well, which we didn't have before, so we're very excited about that functionality. We operate off of an inclusion-exclusion policy and a set of standards that was designated to all of the information and referral organizations around the United States, which is called AIRS. And we have our own internal inclusion-exclusion policy that states that we welcome federal, state, county, city government services as well as nonprofits into our database. And we also allow for-profit professionals into our database so long as they offer a sliding fee scale or if they accept Medicaid or Medicare. allow for possibly providing their service at no fee or no cost. But recently, which I think is really an important thing to note here, is that we have just gotten approval from our board of directors to allow all mental health and behavioral health resources across the state of Wyoming to be allowed into our database with no income restrictions. And I think that that's a real win for the state of Wyoming, and we are currently working on adding all of those resources to our database as we speak. We are constantly updating our data and adding new resources to our database. Over the last year, we've increased the number of resources in our database by 56%. So we're really excited about that. We classify all of the resource services in our database by a taxonomy that has been developed by AIRS. And you can see here the high-level categories that we operate from. And each of these categories, you can drill down about 4 levels deep that give you more specificity for that particular category. So for example, under basic needs, if we had food as the next category, we would drill down and make it more specific to food commodities or food pantry and so on. So each of those are very specific to each resource and service that we provide. Our database is available to the public 24/7, and our website is here, www.wyoming211.org. So here's a real quick snapshot of the resources that are specific to veterans in our database. We currently have about 250 specific veteran resources in our database, but you can see here that we have almost 2,400 resources available to everybody in our database, and of those, 250 are specific just to veterans. So you can see here we have everything from education and training programs to housing and homeless related services, job assistance services. We even have a Veterans Fly Fishing Club where our folks with disabilities or PTSD, for example, can go and join this club, and they can learn how to tie flies, build rods, and they can go out on fly fishing excursions with the club leaders. So we have a lot of variety in our database, and we continue, like I said, continue to grow that on a daily basis. So we're going to do a real quick tour of our website. This is our landing page. You can see up in the left-hand corner that we have a different URL from our website, but you can get into our website through either the URL or by typing in the 211.org website. So as we drill down here, you will see 2 options available to the user. We have a guided search, which is all of those blue buttons, and we also have an advanced search where you can put in your own criteria. For today, we're going to click on military and veterans in the guided search box, and we're going to follow these through. All of these are live links that allows the user to find what it is that they're looking for. I'd like to put add a side note here. We are currently reconstructing this to make it a little bit more user-friendly. We have found that the questions aren't quite specific enough, and the categories aren't broad enough for folks to find things quickly. So we are going to be rebuilding this, and hopefully we can get that done by February. But in any regard, we're going to click on veteran outpatient clinics today. And you can see here that it comes to a GIS map, and you can hover over the magnifying glass or the red button, and you can see what services are found at those particular locations. For today, we're going to click on the red button, and that's going to take us to the Casper location, to the Veteran Medical Services. And this is our landing page. Where the meat of the information can be found for a lot of our services. So you can find the service description, you can find the area served, the application and intake process, the eligibility fee structure, and so on. So if those services have provided us this information, this is where you will find it. You can also go into the advanced search, like I said, and add your own criteria. So we have added veterans in Laramie County, veteran transportation. And so just a couple of inputs here, and then it will bring up a listing of what comes up for veteran transportation in Laramie County. And again, all of these service names are live links, so you can click on the title. So we'll click on the DAV number 2, and that again will bring you to the service page where all of the information for that particular service can be found. So pretty user-friendly. Again, I'd like to note that this page here, we are also reconstructing, and it'll be a lot more user-friendly to use as well. So some of the other services that we provide, I mentioned in my early slide, is that 211 is involved in the disaster and crisis response realm. We currently have a contract with the Department of Health as a contingent call center in the event of an epidemic or a pandemic. So if we get a flu pandemic in the state of Wyoming, they will ask us to stand up and disseminate information to let individuals know where they can go to find health care or safety precautions. We are also a member of the state VOAD team and sit at the table for all of the emergency preparedness groups. 211 can also be used to assess needs and find solutions in communities. When a caller calls 211, we collect demographic information. We always record the presenting need and any unmet needs that the client may have as well. We can compile all of that data and we can provide that information to whomever is looking for that. So here's an example of some of this information that we can find. So we collect gross income, age, employment, and other specific demographic information, and we can provide that out to the individuals. So individuals who are tracking CSBG grants, mayors, county commissioners, and so on, we can share this information out. Here is a quick slide of our top 15 presenting needs and reason unmet. And then we also have a dashboard, 211 counts. This is an API capability that we have, and it will bring up almost real-time data. So you can select your county that you reside in, a time frame, all of these links on the left-hand side here, housing and shelter, food, utilities, those all can be drilled down into the right hand dashboard there so you can see what's happening. So 19.5% of our callers over the last 365 days were looking for housing and shelter. Rent assistance was the top #1 category under that particular need. So we're also involved in several collaborations. The Veterans Collaboration is a big one for us right now. We have contracted with the Wyoming Veterans Commission to add all resources statewide. So we are working with them on making sure that we have all of the veterans resources in our database. We are looking to increase access to quality health care in all of the rural areas with an emphasis on mental health care services in those rural areas, collaborating with PCA. We are also a part of Enroll Wyoming. We have partnered with them since 2013. Our Wyoming 211 community resource specialists are navigators, trained to answer healthcare questions and assist callers with enrollment and eligibility calculations. And we can also refer callers to navigators to assist them with enrollment. And so we can help them with those appointments and get them set up or direct them to open enrollment events. We are also a part of the Wyoming Homeless Collaborative. When we have identified an individual as homeless, we can do a full intake that was developed by HUD, put it into the statewide HMIS system so that those service providers can reach out to them and hopefully get them from a homeless situation to more of a temporary and then permanent situation. Kinship Connections is an initiative of Wyoming 211 and the DFS, where we help those grand families connect to resources and help support the children that they are taking care of. And of course, we're at the table with prevention and awareness, the statewide suicide hotline, contributing resources to our database for the opioid epidemic, and again, adding all of the mental health resources. These are a list of our current funders, and I ask that you all hopefully follow us on social media And if you have the opportunity, we would love to be added to your database or to your website with our URL link. And if you have any questions, please feel free to give me a call. Had a question here. Is there an alternative number to calling 211? And we do have an 888 number, and I can get that. I don't have that in front of me. And our office line, this is my direct line here, but you can contact us at 307-433-3075 or just dial 211.
And actually, just to add on to that, if I didn't mention it earlier, we will be sending out resources after this facilitation is done. It will include a recording of today's webinar and a resource page, and we can absolutely add that number to that resource page that Sabrina was talking about.
Thank you.
Awesome.
Appreciate it. Thanks, everybody.
On that note, we're going to hand the mic over to Mr. House here.
Hi there. So my name is Sam House. I am the Public Affairs Officer for the Cheyenne VA. So what I want to do is I kind of want to give you a little story here. So an individual graduates from high school, and what they get to do is they decide to go into the military, whether it's the Army, the Navy, Air Force, Marine Corps, or under the Department of Homeland Security, they can go into the Coast Guard. They had insurance under their family. Their family covered them. Now, Department of Defense is taking care of their insurance, providing medical care. When they go into the military, they're going to get about 8 weeks of military training. They're going to get a minimum of 8 additional weeks of specific job training, and that additional job training could actually extend into a year or more, learning how to do their military job. They do their enlistment or they complete their military life and decide to retire or move on. At the end of their career, they're given usually about an hour or 2 of VA training. And that is what we're faced with. That's what the VA is faced with, is individuals who don't quite understand how to work through the bureaucracy of the VA. What we're going to discuss today, and it's very, very quick time frame, is the 3 different branches of of the VA and how our veterans can access those resources. So let's see if we can get this thing to
The right one. No, it's doing that.
Oh, there we go. So the VA mission and values, integrity, commitment, advocacy, respect, excellence. It's the I care values. That's what we really stand by, and really our staff. I can attest to the staff in Cheyenne as well as up in Sheridan that we really do care about our veterans and who we are serving. So what makes VA special? So there's a number of different things. I mean, VA is a model for healthcare organizations. VA employees won 3 Nobel Prizes and 7 Lasker Awards. The VA, bottom line, is the largest healthcare system in the nation, if not the world. So some of the cutting edge technology that we've got, I like to give the idea here of home telehealth. Now, I realize that my audience here is primarily medical focused. Home telehealth, I kind of break this down because I really, even though I'm a public affairs officer, I was trained to talk at an 8th grade level, believe it or not. So little joke there. Home telehealth. What is home telehealth? So basically every veteran has the ability to go in and say, I would like home telehealth. Okay, well, sir, what do you want? Or ma'am, what do you want home telehealth for? Well, I'm a little chunky around the middle and I've got high blood pressure. All right, well, we're going to give you this machine and we want you to take it home. And we're going to give you a scale and we're going to sign you up for classes. along with a blood pressure cuff. Okay, so every morning you would go in, you would press a button. I had mine down in my basement. I would go in there. I would listen to this class on how to lose weight. It would tell me to step on a scale. Then it would tell me to put on the blood pressure cuff. It would tell me to adjust the blood pressure cuff so that I have it on right, take my blood pressure, and then it sends all of that information to a care coordinator at the VA. Now that care coordinator, their job is purely to look at trends. They obviously, on the weight control thing, they want to see the trend go down. They would like to see the blood pressure go down. But the bottom line is, if it does go up, if it looks like it's trending up, they're going to contact me and contact my primary care provider and get me in as quickly as possible. So that's home telehealth. Love the process, love that in and of itself. So as you can see, we've got a number of other services, technology that we provide. And if you have any questions specifically on those, by all means, I can talk on those specifically. But we're going to continue moving on. Well, maybe.
Keyboard is the light of my life. Here we go.
All right. So who are we? At the VA, we have roughly 356,000 staff members, and roughly 1/3 of our staff members are veterans. You can see we have 194,000 female employees. Now let's break that down into where the people are. So you can see the majority, 89%, are in healthcare, Veterans Health Administration. Roughly half of the percent is in the National Cemeteries Administration, and 6.2 are in Benefits Administration. So what am I talking about with these administrations? So the VA was broken down identical to Department of Defense. We've all grown up with, be all you can be, join the Army, all these commercials about Department of Defense. So you've got Army, Navy, Air Force, and Marine Corps. Well, very few people, most of us veterans realize that the Marine Corps is actually under Department of Navy. So there's three main services in Department of Defense. You got Army, Navy, Air Force. And under the Navy, you have the Marine Corps. So if VA was modeled after Department of Defense, what we've got here is we've got three different agencies, similar to Department of Defense: benefits, healthcare, and cemeteries. Now, the other way to take a look at this would be past, present, and future. Past would be anything in the past that occurred. So I joined the Army, therefore I am eligible for the GI Bill. I got hurt in the Army, therefore I am eligible for disability payments. So that's benefits. Healthcare is the here and now. So we're going to focus on your health here and now. It doesn't matter. It depends on the service connection on how we bill you. But the bottom line is we're going to take care of your health here and now. And then future is going to be the National Cemeteries Administration and the programs that they offer in pre-planning. So our projected U.S. veteran population right now is 22.2 million. That is pretty impressive. So we are roughly 10 times larger than Department of Defense. Now, what is also very interesting about that number is that we know that only one third of our veterans use VA healthcare. Remember what I was talking about, how much training an individual gets when they join Department of Defense. So they get anywhere between 8 weeks of basic training, and then it can go from 8 additional weeks all the way up to more than a year. So all that training was focused on how to become a military member, but they're likely to get a few hours on how to become a veteran. And part of that number, so the 22.2 million veterans that we have, If you divide that by 3, you're looking at roughly 7 million veterans that use VA healthcare. What's interesting about that, talk very briefly about suicide prevention. We know that 20 veterans a day kill themselves. We also know that roughly 1/3 of them are enrolled in VA healthcare. So 2/3, 14 of them never step foot in a VA. Our mission, my goal, my mission is I want all of our veterans to use our healthcare system. So roughly, again, this is just a slide that talks about Veterans Benefits, Veterans Health Administration, and the National Cemetery Administration. I'm going to run briefly through each one of these agencies, and we'll talk about those, and then we'll close up for some questions. So VBA, Veterans Benefits Administration, they're going to take care of our compensation disability. That's what's really that they're going to be focused on. That disability rating that they receive is always in 10% increments. 0% is a disability. So I'll give you a quick example of a 0% disability. When I was in Afghanistan, I dropped a weight on my foot. I was pumping some weights, and I dropped a weight on my foot. I broke my foot. The forward operating base that I was at, they only had a corpsman. He documented it in my medical record. I get home, it had healed. However, by claiming it and getting a 0% disability later on in life, should I have arthritis or have issues in there, I can go in and have that increase. So compensation disability is very important. Of course, some of the other benefits that you may have heard, vocational rehab and employment offices through VBA programs. I will tell you, and employment within the VA is very important. We have a large number of jobs available within the VA. So let's talk about Veterans Health Administration. So there's dental care, mental health care, long-term care programs. Many of those right there, 3 different things that are based on disability. So, and I've been working on this slide trying to get people to understand that dental care, veterans have to be 100% disabled in order to get dental care. Mental health care, a person doesn't even have to be enrolled in VA healthcare to get mental health care. Long-term care and programs. So long-term care, a veteran needs to be 70% disabled to get care in a nursing home at the VA. So those are 3 very unique services that depend on service connection. So I think that's important to understand. We do take a look at service connection in Veterans Health Administration. However, our focus is going to be here and now. Now, under the Health Administration, we've got Veterans Centers. They're my Marine Corps. They're kind of like the Marines that are to the Navy. All right. So these folks, the people at the Vet Centers, are on the front lines. They're going to help our veterans reintegrate into civilian life. That is their mission. They were developed in late 1970s, early 1980s for our Vietnam veterans to help them reintegrate into civilian life. Individuals, specifically that population, didn't necessarily trust the government and didn't want to be around a whole lot of people. What the Vet Centers provide is an opportunity to be an individual whose records will not be forwarded on to anyone else. So what happens in Vet Centers stays in Vet Centers. We've got a Vet Center here in Cheyenne. We also have one up in Casper. And here's what's interesting about them, is that they are able to look into a veteran's record at the healthcare, at the hospital. However, they are unable, the hospitals are unable to look into vet center records. So they're very specific, and the only way that any records would ever be released out of a vet center is if the veteran actually hand carried them. So there's a lot of benefits to vet centers. So the National Cemetery Administration, people don't like to talk about death. They don't like to plan their own death. The fact of the matter is, right here in Cheyenne, we will be getting our own cemetery. We'll be getting that cemetery here. Hopefully, we'll be able to do our first burial by November of this year, 2020. That's our goal. Really looking forward to working with the National Cemetery Administration. The bottom line here to know about National Cemetery Administration is, yes, they do provide burial space. However, they do not take care of any body preparation. So they will not take care of the casket. They will not take care of cremation. They will provide the space to hold the remains. All right, so specifically with the Cheyenne VA healthcare system, this is what we call a catchment area. We've got 5 counties over in Nebraska, a number of counties north of Denver, and then of course the southeast Wyoming, part of Wyoming, so Carbon, Albany, Platte, Laramie, and Goshen County. Where you see the stars on this slide, that's where we have clinics. Pardon me. So 3 of the clinics up in Wyoming are actually mobile telehealth. One of them is a telehealth, and then the other one is the hospital. So over in Rawlins and Carbon County, that's where we have our telehealth clinic. And then up in Albany, Platte, and Goshen counties is where we have mobile telehealth. We're there 2 days a week in Albany, Platte, and Goshen counties, where we're a full-time clinic in Rawlins. Currently working, we see 2 full-time clinics down in Larimer County in Colorado, and that will be consolidated here by 2022 to be 1 large clinic. Everything else in Wyoming is covered by the Sheridan VA healthcare system. So if you were to call me about a veteran in the Sheridan VA, I'm going to try and help you as much as I can. But the bottom line is their records are going to be very specific to the Sheridan VA. So I'm going to call my public affairs officer up in Sheridan to see if she can help me. So by the numbers at the Sheridan VA, Cheyenne VA, 24,591 veterans. That was in FY19. The number of veterans who are using our programs. So what we know, I'm going to click back to this one. In that catchment area, I will tell you we have roughly 75,000 veterans, but only 1/3 of those 75,000 veterans are using VA healthcare. I am hoping that we'll see that number increase, and with it's going to increase. We know through partnerships with, like we're seeing with Wyoming 211, it's getting the information out there. As you can see there, some of our other statistics, our budget for 2019, $196 million. Believe it or not, this year hasn't changed a whole lot, or we're hoping to see a larger budget increase next year. So how does a veteran get VA healthcare? So the key thing is enroll in VA healthcare. So a VA Form 1010-EZ, along with a copy of their DD-214. That's their discharge paperwork from the military. Some of the typical reasons why individuals are not getting their eligibility, or their healthcare, is because they make too much money. So let's say I'm a veteran who lives alone and I make $30,000 a year. I have no dependents. Because my salary, because of what I make, and here's the other key thing, I don't have any disability, so I'm non-service connected. As a non-service connected veteran making $30,000, I am not going to be eligible for health care. I make too much money. Now, how do we change that? Immediately, we got to get that veteran over and evaluated for a service-connected disability. What are some of those service-connected disabilities? You've got head, shoulders, knees, and toes. So every Army veteran who served in the Army did sit-ups, fingers interlocked behind the neck, so neck and spine issues. More than likely, they have ringing in the ears, tinnitus. More than likely, they have hearing loss. So each one of those items is some sort of a service-connected disability. And so encouraging our veterans to file for service connection is very important. Once they have a service connection, then we don't care how much money they make. That requirement goes away. So the other reason why a person would not be eligible for health care is that they never served on active duty. And we see that in the National Guard and Reserve. My entire career was National Guard and Reserve. The time that I spent on active duty was all deployment time. So that deployment time, that active duty time, is what qualified me for health care. Individuals who typically serve in the National Guard and Reserve don't have a thorough medical file to get them service-connected disabilities and get them eligibility. That's something I personally am working on with our congressional members and letting them know that we need to change that. So the most common way to become eligible is, again, apply for a service-connected disability. So how does a veteran get a service-connected disability? The way is for them to apply for disability through a veteran service officer. So right here at the Cheyenne VA, we have three different veteran service organizations. We have the American Legion, DAV, Disabled American Veterans, and VFW. Now, the Wyoming Veterans Commission is another great resource, and they are a veteran service. They have veteran service officers who work through those other three. So they will work with our veterans. They'll combine and get all the material that they need for filing for a disability, and then they will provide it to either the American Legion, DAV, or VFW to submit. The key thing on this is that veterans should bring a copy of their DD-214 along with a list of physical and mental issues that were caused by the military. And this is a key thing. It had to be in the military in order to be a service-connected disability. So what I tell all of my veterans is write a one-sentence paragraph on the who, what, when, where, why, and how. So in 1989, while I was at basic training at Fort Benning, Georgia, I was on the rifle range when my earplug fell out and was with my battle buddy, Michael Irwin. So there I've got the who, Michael Irwin, the what, when, where, and why. If you can put that all in one sentence, that will help those veteran service officers assist you in getting that disability or getting the veteran's disability. Okay, I need, next slide.
Oh, sorry. Why is that doing that? It's so bizarre.
Okay, so this is new. This is a big one for us. As of June 6th of 2019, under the Mission Act, all of our veterans are now eligible for urgent care benefit within the community. Now, here's the key thing. They have to be enrolled in VA healthcare in order to get this service. The benefit provides another option for treatment of minor injuries and illness. So we're talking urgent care, not emergent care. The big difference there, and there are some places here in Wyoming where they've actually combined those two terms, and it makes it very confusing for our veterans as well as the VA. So the key thing is urgent care. On this link right here, the VA Urgent Care Locator.triwest.com, you can go in there and actually find out who is an urgent care provider, and providers are able to sign up through TriWest. All right, with that.
It's question time.
Oh my goodness, looky there. And I think it's just right on time.
Right on time. So we do have a few minutes left here for some questions. If you would like to verbally ask your question, please make sure to unmute yourself. We were trying to work on making sure that everybody was muted during the presentation. I will start with a couple of questions that we got through the chat box, and then we'll go from there if you guys have some more questions. One that we got for Sabrina for 211 today was, are you guys 24/7?
We are not 24/7 at this point in time. Right now, we do not have the call intake or influx to warrant being 24/7. However, that is a goal of all of the 211s across the country. But until we can warrant the call volume, we will remain a Monday through Friday call center.
Awesome. Thank you. Still watching the chats here. We've got another one here for Sam. What is a DD-214?
So a DD-214 is discharge paperwork from Department of Defense. So DD, anything with a form DD is Department of Defense. The 214 is the single most important document a veteran would have. It shows their time in service. It shows all of their awards that they earned, and it would also show their eligibility for VA healthcare. So it's one of the most important, like I said, the documents that any veteran, any service member would get.
Okay, we got another one for Sam. What do I do when I have payment issues?
Well, and that is a very good question. The best way that I can tell, take my phone number, make sure you call me. There's a series of people that we can get you in touch with in order to solve your problem. So call me. The other option, if you can't remember my phone number, you Google Cheyenne VA Medical Center and you'll get their phone number. The main phone number there is 307-778-7550. From there, you can press 0 and then press 1. That will get you to our patient advocates. They will be able to assist you. What you need to know if you are a provider is that knowing where the consult came from. So if it's a TriWest consult or if it's a VA consult. If it's a TriWest consult, definitely get on the phone through the TriWest website and use that. If it is a VA consult, then contact us and we'll make sure that you get to the right location either way.
Cool, thank you guys. I'm just going to throw in real quick before our next question. I do want to highlight that part 2 that's going to be happening a week from today will actually be highlighting the Sheridan VA, which I know we've mentioned a little bit as far as covering the rest of Wyoming. And we'll actually have representatives from TriWest as well to speak specifically to. I do want to clarify, we got a question about discharge paperwork from Stacy Quick. Stacy, would you mind elaborating on your question a little bit?
I'm wondering if she was answering the question before.
Okay, never mind. I was going to say that was a very short question. How are you guys doing? How are we feeling? Do you have any questions for those online?
I can provide those telephone numbers. UW had asked for a different number than 211 because their phone system doesn't allow for the 3-digit to go out.
Oh.
So we have an 800 number or an 888-425-7138. And then we also have a direct line to our office. So that's 7138. And then we have an administrative line, which is 307-433-3075. So if your phone system doesn't dial out the 211, you can utilize those numbers.
There we go. Thank you.
433-3075. 306.
So we are currently including those phone numbers in the chat. Again, I'll make sure that that goes out with the resources. So while we give people a little bit of time to maybe think about any other questions that they have, I do want to remind you that there will be evaluations going out. We would love some feedback, some information, the more the better, regarding these veteran webinar series, along with all of the rest of our series. And you will also be receiving a copy of the recording and the resource list. Just so you know, the actual evaluation piece will only be going out to those who have attended today. But if you signed up for it, you'll still get the recording and the resources that are going to be sent out. So those updated phone numbers, we'll make sure those are on there as well. Alrighty, my friends, we have just a few minutes left. Do we have any comments or questions or things you want to say to these two before we let them go? Just please make sure to unmute yourself. Will we get these PowerPoints? So we do have a chat coming up from C. Cates, and we will be sending out it'll be a recording. The slides themselves, we're looking at including that or not, just because in one of our veteran webinar in part 3, we are not able to send out the slides, but 100% the recording will be available. I'm going to try to make the slides and the resource list also available. Let's see, UW Family Medicine to Cheyenne, thank you for an excellent presentation. Aw, you guys are so sweet. Thank you for attending. If that's it, we'll go ahead and wrap up part 1 of our veteran care series. And I just want to thank both Sabrina and Sam for their time and their expertise. And you know, you've got their contact information, and let's bring our community together to support our veterans. There's so many here in Wyoming and so much to offer. So I love that we're seeing different areas of our community come together. Thank you very much, and we'll hopefully see you next week for part 2.
Thank you.
Thanks, everyone. We're going to go ahead and be ending the meeting.
Yeah.